Welcome to the second session of our 21st Signature webinar series. My name is Mitchell Rosen, and I'm the director of the Rutgers School of Public Health Center for Public Health Workforce Development. The 21st Signature series is an annual initiative that connects thought leaders from New Jersey, across the US, and the world with our schools community. The theme of this year's series is Public Health Workforce Development, and we will explore how we can prepare, train, and educate an agile public health workforce that's prepared for post-pandemic challenges and advances. It's my immense pleasure to introduce today's signature speaker, Dr. Brian Castrucci. Dr. Castrucci is an epidemiologist, public health practitioner, and fierce advocate for the public's health. He joined the Beaumont Foundation as his third employee in 2012 and assumed the role of president and chief executive officer in 2018. Following today's presentation, we'll host a Q&A session, so feel free to submit your questions in the Q&A box at any time during the webinar. And with that, I'll turn it over to you, Brian. Thanks for being here.
Thanks, Mitch. I'm super excited to be here. I've been a longtime public health practitioner. I started out in Philadelphia Department of Health. I went to the Texas Department of Health, Georgia Department of Health. I was a Title V and WIC director before coming to the philanthropy here at Beaumont. So I worked my way up through public health, super important to me. And so I want us to think about today the skills that we need moving forward in public health. And so, I lied. It's not 5 needed skills. We're going to do 4 needed skills today. And so what we have to do in public health, and this reflects on the election. We'll talk a lot about the election too from time to time. We're going to have to communicate better. We're a 140-year-old profession without a clear value proposition. That's a problem. We got to fix that. We got to focus on policy. Policy as medicine is something we have to be better at. The way that we solve population health problems is through policy. It's not going to be through programs and interventions. Those are temporary solutions. If you've ever worked on programs, I was an MCH person, so I used to work on nurse-family partnership. Nurse-family partnership's amazing. There's great outcomes. It's also super expensive and doesn't go to everyone in a community. It goes to those who are within the first 12 weeks of gestation and first-time moms. So when that program is defunded, or when we don't have enough funding for everybody, we're only helping a small number of people. Now, absolutely, you can change population level outcomes by only helping a small number of people, but it's not the outcome you want, right? So just be thoughtful about that. We have to build better partnerships. We're going to have to center health equity. Okay, so let's start with better communication. Many of you may remember the old game Pictionary, where you'd draw, you get a little note, it would give you a clue, and then you would have to go ahead and draw it, and you would get a point if other people could guess it. So the one thing I don't like about Zoom webinars, I can't see you all and I can't interact with you. But if I drew this, I can't even see. Let's see. Let me pull my webinar back up. Okay. If I showed you that, oh, I guess you can say stuff in the chat. What do you think that is? Now, oh, people saying they can't hear me. Hopefully that helps. When you look at this, what do you think it is? Now, I'm not an artist, but I think you can probably tell it's a hamburger. So you were able to see that and immediately know it was a hamburger. What if I asked you to draw public health? What would you draw? What would you draw so that anyone else would know it's public health? And so at this point, you should be thinking, gee, I don't know what I would draw. That's a problem. Because if you, public health students, don't know how to draw public health, how do you expect lay people and legislators to do it? This is our communications problem. And we're not helped by the fact that we are acculturated to medicine from jump, right? If you all have kids, Or if you're just a fan of Disney, you've seen Doc McStuffins, which is all about, a young child who's a physician, and once they put on that white coat, they can solve all the problems. I mean, this is a sampling of all the shows that we see that acculturate us to medicine solving our problems. But where's the show that acculturates us to the fact that our individual health is indelibly tied to community health? We don't even learn that until college, maybe. I asked my kids, how do smoking ads influence your smoking uptake? And they said, what's a smoking ad? Well, right, in my community, we don't have smoking ads. I don't have a plethora of fast food. All of this is in the realm of public health, but it is not something we talk about. So when you're thinking about communicating better, one of the things we have to do is improve our messages. Let's look at some really bad messages, right? Trust the science, really bad message. Defund the police, really bad message. Both messages were weaponized against public health and social interests. We didn't really want to defund the police. We wanted to recreate the police, transform the police, have social workers, community members with the police. We wanted to make policing better. Defund says get rid of them. That's not really what we wanted. And even if we did, it's not politically feasible, right? Trust the science. Another really bad message, because it kind of says to you, like, we don't need your opinion. Just trust us, who you don't know, who you've never met, who you've never heard of, but trust us. What's the first thing they tell you to do when you get a diagnosis from your doctor? If your doctor says, oh, hey, Brian Castrucci, I'm sorry, but you have prostate cancer. First thing they tell you to do, go get a second opinion. Why didn't I trust the science and just start chemotherapy? So we have to get our messaging right, and our messaging to a broad number of people. And during the pandemic, I had worked on messaging to the political right on COVID. And one of the issues was around how fast we came up with COVID vaccines. And the right message is, we developed those vaccines by cutting red tape, not corners. So what do you do in that message? You explain why they happened faster, and you play on a value, right? This idea of government bloat and government bureaucracy, and that people don't like it, especially conservative voters. There you go. We cut red tape. All that red tape you've been telling us is a bad idea. We got rid of it. We got you this vaccine really fast, but we never cut corners. We also need to identify the right messengers, right? The right messages need to come from the right messengers. Tony Fauci, wrong messenger for the political right. So we had Fauci fighting with Jim Jordan and fighting with Rand Paul. That didn't help us. That didn't help anybody. So that we have, again, right messages, right messengers. And what you have to think about are things called micro-influencers. So in your hometown, where you live, right? Whether it's in New Jersey, I'm Cherry Hill. So if you know New Jersey, Tom's River, Cherry Hill guy right here. Haddonfield. I'll be in Haddonfield for Thanksgiving. So if anybody is in New Jersey for Thanksgiving and want to give me a break from my in-laws, come have a cup of coffee with me in Haddonfield, and we can talk about public health. These in your home community, who's the influencer, right? Who maybe has a Twitter or social following, less than 10,000 people, but it's really focused. It might be the person that runs the local soccer league, or it might be a very popular DJ. It's not Leonardo DiCaprio, and it's not Megan Thee Stallion, but it's someone who has a real significant influence in your community. What if they are actually giving messages? There was a CDC study that looked at CDC's messaging around flu vaccine and micro-influencers. The micro-influencers outperformed CDC. We trust people we know. We listen to people we know. I find it fascinating that we went into this pandemic and had religious leaders saying, you do you when it comes to the vaccine. And when I would meet with them, I would just simply ask, where is that in the Bible? Is that like Mark 7:15 and Jesus said, you do you? I mean, regardless of the religion, you do you is not aligned with any religious doctrine. But we needed those relationships. We needed those key messengers before a pandemic. Never try to communicate with new audiences in the midst of a crisis. It's a bad idea. We're going to have to center the WIFM. What's in it for me? Everybody on this call really cares about public health, and we do things because it's the right thing to do. Well, that suggests a value, right? The right thing to do. What's the right thing to do? The right thing for me is to root for the Patriots on Sunday. That is not the right thing to do if you're a Jets fan. So my right thing to do is different from a Jets fan. It's not that different for public health. We do things. We believe in the communal good. We believe in helping communities. We believe in inclusivity. These are values. And so if someone doesn't share those values with us, we need to start focusing the message on that. If you're a business, public health helps you by having healthy employees, a healthy consumer base, right? Those kinds of ideas. If you're talking to a superintendent of schools, don't talk about lower smoking rates. Talk to them about higher reading rates and higher graduation rates, right? My wife will say to me, you know, Brian, if you don't take out the garbage, I'm going to leave you. So if I don't want to stay with her, there's nothing in it for me. The fact that I would like to stay with my wife of 20 years, that's what she's done. She's set up the what's in it for me. I don't want to take out the garbage. It's cold in Maryland. It was freezing last night when I took out the garbage. So why would I do that? Well, there's something in it for me. Okay. We don't do this enough in public health. This is a Fauci issue. Don't speak with certainty where there is none, but we have to get better at this. Do you remember when Dr. Fauci said, don't wear masks? He was speaking with certainty. He said, don't wear masks. We're not going to have to wear masks. Then we had to go back and say, we are going to wear masks. That's not great. And so we are in a world of changing science, and we have to recognize that. So changing that language to, this is what I know today. This is the state of the art for what I know now. And if that changes and it changes our guidance, I'm going to be back with you to tell you how it impacts you. But we're going to have to be more cooperative with the public. But when we speak with certainty, when there is none, you are absolutely setting yourself up for a letdown, because you're going to have to go back on that. And that's not great. Lead with science and not politics. We are scientists. We need to stay pretty tight to that, guys. That's what public health is. We're a science. We don't do electioneering. We don't have a point of view. We are scientists. So I'm gonna give you one. I'm gonna give you a couple here. We had told everybody that they needed to not go to their Thanksgiving with their family. They needed to not go into, for Christmas dinner. They needed to skip that concert and not gather together and skip their kid's birthday and all that. We told everybody that. And a lot of people listened to us. And then after the George Floyd riot, after the George Floyd murder, there were protests that followed. And many cities allowed those protests, even though people were unmasked and gathering in very close proximity. Why was that okay? Because I listened to you. But what it looks like here is when it's important to you, then those rules are easily broken. Now, I'm not weighing in on this to say like those protests were right or those protests were wrong. What I'm saying is, what did that mean to somebody who was absorbing our messages but didn't share our value on the protest and the importance of standing up for racial justice? So how is it that we're going to lead with our science, not our politics? That's really important in public health, because I will say this and write this down. If you feel unprepared to communicate effectively and work with this administration that was just elected, that's on us. That's our job. Our job is to work with whomever is elected. We should not only do public health when one party is in control and then like shut down when another party is in control. That's not okay. And lastly, we have to be visible. This public health is the invisible soldier watching you. That's nonsense. Okay? You have to be visible. We have to see you. So your dean, Perry Halkitis, I love Perry. Perry's great at this. Perry's everywhere. He's seen. That's why Rutgers is such an emerging and strong school of public health. We see him. Perry's running Rutgers. I mean, could you even name some of the other deans? Because they're not out there. Same thing with health commissioners. I need health commissioners at the opening of the Froyo, at the Kiwanis Club gathering. I don't need them running the health department. That's the job of a deputy. Your job is to do the political job, is to be out there meeting people. Because what happened during COVID is the health commissioner met with business leaders for the first time ever. The business leaders are like, hey, health commissioner, great to meet you. What brings you here? And the health commissioner said, I'm here to shut down your business for a couple weeks. Oh, that's a bad first date. I don't want to swipe right on you ever again. Who are you? Where'd you come from? Who elected you? And then the unraveling starts. Because we didn't know folks. We weren't visible to them. I wanted business leaders to stand up and say, I don't like what this health commissioner is doing, but I know this health commissioner. I know their beliefs. I know their values, and I'm going to do this. Imagine how much more powerful that would have been. I want you to think the challenge with public health is we're not always having clear and consistent communication. If I said I'm holding a red can with white script lettering, you would know almost instantly it was a Coca-Cola. But what is the public health brand? So this is an example of the public health impact formula. Now, I like this. We diagnose, we cooperate, we prevent. That's what we do in public health. That's very clear. What do you mean by diagnose? I mean that, we look to communities to diagnose problems. We listen to the people there. We use data and evidence, and we want to offer solutions to health problems to make everyone healthier. What do you mean by cooperate? Well, we're going to work with everybody in the community. Public health is a team sport. We're going to work with schools and businesses and government agencies and communities to bring everybody together to make decisions and take action. And well, what do you mean by prevent? Well, we often end up in a doctor's office when we're sick and injured. I don't want to end up there. I want to do things in the community that affects our health that we can prevent, and so that we don't have to ever have those health problems. Diagnose, cooperate, and prevent. I find that to be a compelling message. We've tested this message. The problem is we aren't all using it, right? When you were listening to people during the pandemic, it was like public health is like a firefighter. Public health is like a weasel. Public health is like a babbling brook. It's like, wait, it's a firefighting weasel by a babbling brook? What does that mean? Let's get consistent, right? Public health is this. We need consistency. Medicine has consistency. I'm sick, I go there, I get better. That's the whole value proposition of medicine, right? We don't have that same value proposition. And it has to be a value proposition that is universal. Someone asked me once, a Republican pollster friend that I know, said, Brian, does public health help poor and vulnerable communities? I said, absolutely. And he said, thank God, because I'm neither poor nor vulnerable, so I don't need to care about public health. And I was like, no. Public health affects everybody. I said, no, you just told me it supports poor and vulnerable communities. The message you need to lead with is public health helps every person in every county, in every corner of this country. And then that opens up an option for them to ask, well, tell me how. How would we be different if if we led with the second message rather than the first? Something to think about. Okay, in this presentation, gang, I'm always going to have resources because I know you're going to remember like that smart and witty and handsome guy from Beaumont. What was his name again? Oh yeah, it's Brian. Some of you will remember that. Good on you. But a lot of you will just want the resources. And I think it's really important. Public Health Communications Collaborative at publichealthcollaborative.org has an academy for that helps you. Now it was coming this summer. Now it's here. You can sign up for it. Teach people how to communicate, how to develop the right messages. Public Health Collaborative, which is again, Public Health Communications Collaborative, PHCC. Messaging, information outbreak alerts, tons of stuff that is useful to the emerging and thoughtful public health practitioner. Phrases.org really helps you understand messaging and how to message to other sectors. And most of all this you can find in Talking Health. Hopefully a really thoughtful professor at Rutgers will teach a course and use Talking Health as the book. Katie Evans, if you ever interested in a Talking Health training, happy to do it. Happy to do it on site in New Jersey, mostly because I'm in New Jersey more often than not, especially through the winter. Katie Evans can help you do that. This is the slide you take the picture of, because these are the resources. All right, let's talk about policy as medicine. Now that you've heard of the food as medicine movement, that's silly. Food is food, it's not medicine. Policy, though, can be medicine. This is how we fix our communities. Do you want to have people age in place? Well, you change the building codes. You change the maximum limit on how much a stair can rise from the previous stair. That keeps people from tripping, prevents hip injuries. How many lights at what lumens you need in a stairwell, right? If you have, we have housing. Housing's a huge issue. Housing will be solved by policy. Green space, right? As some cities are just overdeveloping, maybe you say to a builder, there could be a policy that says, hey, if you want to build on this space, you have to put this much green space in as well. Policy will allow us to change how our country is, right? What did Shakespeare say? All the world's a stage and the men and women merely actors. I would go further and say policy sets the stage on which the actors play. The problem we have, of course, is that in this first graphic, the boat is sinking and we want to give healthcare bigger and more buckets, but we got to fix the hole in the boat, and that's social determinants. Let me be super clear. The only way to affect social determinants of health is through policy. Policy and systems change. That's it. So if you tell me that you are helping change the community's social determinants by hiring a community health worker or by opening a food bank, I'm going to tell you you're dealing with social needs, super important, but not everything. This is that idea of that social needs versus social determinants. Social needs are one step up from downstream, kind of in that midstream space, but the individual impact is still what's focused, what's centered. We need to focus on the community impact. And you see healthcare right now with these kinds of headlines. These are all social needs, ride sharing programs. That's social need, right? Because if Lyft is giving me a ride to my doctor this month, but next month it decides now we're not doing that program anymore, it's gone. So the determinant is still there. The determinant is access to transportation. The need is I need to get somewhere today. Okay, if you can get that difference and be advocates for that difference, then this whole talk is worth it. Another great resource here, City Health. It's a program that Kaiser Permanente and Beaumont kicked up together. These are our 12 policies. We rate the 75 largest cities in the U.S. We've been able to pass a bunch of policies. We give mayors medals. Mayors love getting medals, and they'll help pass policies to get themselves medals. Check this out at cityhealth.org. Some other great resources. Health Impact in 5 Years was a CDC project that is now, unfortunately, in mothballs, but all of the research and all of the policies still there, still amazing, right? All the evidence base was done for you. And this promoting health and cost control in states is another examination of what policies are in place in states that allow us to have better health and better well-being. When we think about the mental health crisis, you have to think about how we're going to do mental health at a population level. How are we going to help support people at a policy level? We do not have enough providers to treat our way out of our mental health crisis. So we're going to need policy. And this book, you can get on Amazon, Policy Engagement, written by 3 of the most badass people I know in public health. Shelley Hearn, who founded Trust for America's Health, Keisha Pollack-Porter, who's at Hopkins, and Katrina Forrest, who runs the City Health Program. Used to be chief of staff for a council person in DC. This book is amazing. It's cheap. I would encourage everybody to go get it. All right, building better partnerships. Right now, we woke up on the morning of the 6th and we were like, oh my God, what are we going to do now in public health? And part of our problem in public health is this graphic. It is a CDC graphic. It is horrific because look, we're like the sun. Public health is the sun, and all these other things are planets. This is the most out of touch graphic ever created in the history of time because we aren't the center of the universe. We are a player in a vast ecosystem. And so we need partnerships with all these people. We are not the hub. We are going to be the spoke in a lot of different wheels. And so that's something that we have to be thoughtful about. And this really does relate very closely to the need for finding messengers. Okay, if you are getting ready for a bird flu pandemic, an H5N1 pandemic, and you're worried about reaching conservative voters, you need to find conservative partners who can deliver messages to conservative voters because they're going to listen to someone who's like them. And if I said to you, I'm going to go talk to all the communities of color in New Jersey, someone should stand up and be like, aren't you like a straight white guy? Are you the best person to go talk to those communities? I'm like, oh, that's a good point. Maybe I am, maybe I'm not. Maybe I should go with somebody. Maybe I shouldn't go at all. These are questions we have to start asking. Who are the right messengers? And if we identify messengers we need, then we have to have partners there. Now, let's talk about our election and our election outcome with President Trump now. I don't think President Trump's going to listen to public health. I really don't. But there are people he will listen to. And I think one of the groups that is in there are businesses. We have to have better relationships with business. We have to help them understand that, when it comes to the pandemic, so there's a little sore point right now that post-pandemic, do we wear masks? Should we require vaccination? How do we handle this? They were left on their own. Public health should have been actively engaging businesses before the pandemic. In my perfect world, a health commissioner had a call with all their businesses in their community and said, like, buckle up, Buttercup, this is going to get bad. We have a respiratory virus out of containment. And this is what that means for all of us. And I'm going to come here every Friday and I'm going to tell you the status of the virus and what it means for you. And if you are nervous about this and you're up at 3 a.m, call me. I'm probably up at 3 a.m too. How would that have changed the way that business and the public engaged with us? Right? These are 2 reports that we've written. Good health is good business. Let me give you another thing to read. It is one of the most underlooked resources in public health. Jerome Adams, who was the Surgeon General under Trump, late in the Trump administration, released his Surgeon General's report on health and the economy. It's really good. It got overlooked because of the politics around Trump and the timing, but go look that up. You should really have a good sense. Brilliant people were the authors. It's not right wing. It's very thoughtful. Look that up. These are resources that we've had. And I also want you to figure out how to access the Health Action Alliance. The website is healthaction.org. They are working with businesses to create healthier and healthier workplaces and stronger communities. What I believe is that public health and community health is the new workplace wellness, because 80% of your healthcare costs in a business come from spouses, children, and retirees, none of whom benefit from the yoga class that you did or from your healthy cafeteria. So the community and community health is just as important as what you're doing for your present employees. And all your present employees go home to a community at night. Health Action Alliance is working with businesses, looking at MPOCs. These are older resources before they changed how we referred to MPOCs. Pandemic preparedness plan. For every business needs a pandemic preparedness plan. Mental health. Businesses are on the front line of the mental health crisis, right? They're not skilled in how to deal with this. It's really interesting. The Society for Human Resource Management, SHRM, is now starting to talk about social determinants. I think that's amazing. But we have to figure out how in our communities we bring businesses together. We should have a business council. Every health department needs a business council. We need to center health as an economic indicator. Okay, this is the conversation we have to start to have. This is where I talked about the mental health the workplace mental health playbook, another resource that HAA put out. Okay, and this is a 3A. This is for students. Like, I'm talking right to the students. You have to know how to do business, finance, and administration if you want to do public health. Okay, I know that's why a lot of us didn't get into this work, but when you're doing a, I don't know, $16 million Title X program, you want to be able to know a budget and what a budget narrative is and what a fringe rate is, what an indirect cost rate is. And so we built this BEAM program, which you can find at beamskills.com. BEAM is an acronym because, you know, I have a DRPH, and so I took the course on how to make everything an acronym. Building expertise in administration management. This is a 20-hour asynchronous course. You get a certificate at the end. It's done by the University of Miami. But we go through how to write a scope on a contract, how to do contract monitoring, how to write a budget, how to write a budget narrative. You know, you do this long enough and someone's going to come to you and say, oh, gee, I have the budget for this program. And you look at the budget and you go, wait, how are you recruiting staff? Oh, I'm going to do some flyers. How are you paying for those flyers? You know, we got to pay for them. No, they have to be in the budget. If you want to know what an organization cares about, look at its budget. That's where you really see where people care about. I could tell you, I really care about kittens. I do. I actually do really care about kittens. And so the question to you should be, well, then, Brian, how much of your income goes to supporting care for kittens? It's more than I'd like to report on this webinar. You know, my wife and I will give money to various, you know, cat saving organizations. We don't do dogs. We only do cats. But that show, if that line was zero in my budget, then what do I really care about? Do I really care about kittens at all? So I wanted to put this in just so you guys can think about this and consider this, because what you're looking at as a student are differentiators when you come out of your training. A lot of folks will graduate with MPHs, all with very high grades. I don't want to upset the professors, but like kind of A's and mostly A's and some B's here and there. But generally, we all have GPAs in graduate school of 3.5 or higher. So what's your differentiator? Having this kind of training and certificate can be a differentiator. And it gives you a super amazing skill set that is not required in schools of public health. All right, let's lastly talk about centering health equity, and then we'll get to questions. This is the revised 10 Essential Services of Public Health. 10 Essential Services of Public Health came out in 1995. No one updated them until 2020 when de Beaumont and a team of folks did it. This is the current 10 Essential Services. Health equity is centered in the middle. That was deliberate because health equity isn't a essential service. It is a cross-cutting essential service that undergirds all of these other essential services. And when we think about COVID, we got to remember, you know, our country has a unique history of racism that is still very much in play today. So when people say, why did things happen worse in America than in other countries? Well, partly it's because, you know, we have a lot of kindling in the US, poverty, hunger, homelessness, disparities, but racism is a really big kind of, you know, piece of wood on that pile of kindling there. And if you look at other countries, they can kind of take some of those logs away. But COVID would have been different in our country if we didn't have as many logs on the fire, if you will. So we've asked health departments in our PH-WIN survey, Public Health Workforce Interest and Needs Survey. It's the largest survey of the governmental public health workforce in history. We have a survey in the field right now. As of yesterday, I think we had 45,000 responses, 60 more days of data collection. It will be my Christmas miracle if we're over 50,000 responses by the time I wake up on Christmas morning. That's my gift. That'll be my gift. So he asked, to what extent have you been engaged in efforts to address racism as a public health crisis in your health department? We just are pulling here the answers of those who said somewhat or to a great extent, and it was only 37%. So for all the health equity work that we talk about, the numbers aren't really bearing that out. Do you believe that addressing racism as a public health crisis should be part of your job at a health department? Take a minute. What do you think that number is? What percent would say yes? Was it more or less than 72%? 72% of our respondents in 2021, and we're talking like 43,000 responses, said that racism as a public health crisis is part of their job. And then lastly, do you feel that you have adequate funding to address racism as a public health crisis? And we got 42% saying that they do to some extent, or to a great extent, have the money to address it. So remember when CDC declared racism a public health crisis? And everyone's like, oh, wow, that's impactful. There wasn't a dollar put behind that. You should have taken every NOFO and every CDC program and said, you can take X percentage to address racism in that project. We haven't done that. So when we think about, centering health equity, let's not just talk about health equity. That's not progress. That's words. I also want you to be very thoughtful about how you talk about health equity. Unfortunately, health equity has become a term that is triggering to some on the political right. And we have to be thoughtful. Do we want to be idealistic and say the words and talk about the concept? Or do we want to be impactful, which actually means making some changes to advance health equity and achieve our outcomes? So this is something I want us to think about, right? And some of the resources here, healing through policy. So we believe at Beaumont that racial healing must be facilitated by policy change. That resource has a ton of policies and programs at a population level to help advance racial healing. It is worth a read. MADE for Health Justice. MADE is, I know shockingly, an acronym for Modernizing Anti-Racist Data Ecosystems for Health Justice. We have to put data under the microscope. And when you look at data modernization and the conversations around data modernization, they talk about data modernization like it's a tech issue. It's not a tech issue. It's a human issue. I Googled shoes a couple weeks ago. I'm still getting ads for shoes on Google. Don't tell me the tech's not there. It's the human problem. How do we use it? How do we collect it? Right? Why can't we get a birth record that can identify same-sex parenting? It's not there. It's not a response category because we still look at birth records as a biological experience, right? But why? Everything else has evolved. Why can't that? How have we engaged the people about whom our data are, right? Where are the voices, the people who are measuring, where are their voices? How do we have them centered in the discussion about research questions? When I was in Philadelphia, never forget this, the Edinburgh Depression Scale. It's one of the primary depression scales postpartum and that you use, especially in Healthy Start. And there's a question in there, things get on top of me sometimes. And we unpacked that question with our client group. And the way they heard that was like literally things get on top of me, like my hat, this blanket. And so it's like, wow, clearly this wasn't tested in our population. Those are the things we can avoid if we center people and communities and community voices in data collection. More importantly, if you've not read Abigail Echohawk's stuff, it's totally worthwhile because she makes a point. It's a good point, and I have a solution for it. But all that messaging stuff that we came out with during the pandemic, that was all done in a random sample of 1,000 U.S. residents. It didn't ever include people from smaller communities or for her tribal communities up in the Northwest. When we say things like Republican, what is a Republican? Because I'll tell you, if you take a Massachusetts Republican and a Georgia Republican, you would, I mean, they're the same like general species, but there's a lot of difference, right? It's like a pilot whale and a blue whale. They're both whales, but I guess a pilot whale is a dolphin, but just go with me here. A pilot whale and a blue whale, very different whales, still whales, but very different. RWJ, which is in Princeton, home, there in New Jersey with y'all. go Google this address, take this address down. They do some brilliant messaging work with how to talk about health equity without ever saying health equity. So how do you get to the concept without the words? If the words are triggering in certain spaces and places, then don't use them, but still get to what you're going for. That is a great resource, totally worth checking out. Another super resource. This was a documentary done by Bloomberg Philanthropies. Mitch, if we ever want to do a showing of this for fun, maybe during Public Health Week with students, we could get a panel together and do it. I'm in the doc. Josh Sharfstein's in the doc. Mary Bassett, George Benjamin, Sandra Galea, fabulous people talking about a lot of different stuff. It's 3 or 4 episodes. You can see it here. And if you love public health, then take your Thanksgiving break and watch this and geek out and remember that there are real reasons to love public health. All right, so those are the slides. I am going to try to figure out where my questions went.
All right, Brian, I'll help you out there.
Okay, good.
Thanks so much. There are a lot of questions. So interested in your thoughts on communication and messengers when we have so many health influencers on social media with large audiences, but sharing messages that are dangerous to public health. What are your thoughts on that?
We have to pre-bunk. We have to have a place where people can get the right information. Like, people are going to grift. It's what we do. And people are going to get out there and start saying crazy stuff. But what's our counter? Listen, I'll ask you this. Who's our Joe Rogan on our side? We don't have one. That bothers me. So it's not that we're always going to have people saying stuff that is not great, but we're going to have to get people to go to other resources and make those other resources equally engaging. So this is a fight now, right? It's a much bigger, and this is my biggest fear post-election, is the legitimization of misinformation from government sources. And if you look down in Florida, you'll find misinformation on the health department website. And the state of Florida is the same state that tells you it's the state that tells you when to evacuate when there's a hurricane. So if they say evacuate, and I listen to that, but then they also say don't take the mRNA vaccine, should I listen to that? That's the thing that I'm really nervous about, legitimization of misinformation from government sources. I hope that helps.
Yeah, thank you. You said to use the what's in it for me, but how do you get people to change the perception of public health as a nanny that wants to take away personal choice? I want to drink or smoke, but you tell me not to. You're infringing on my personal choice. So how do you the what's in it for me when there's a different perspective on things?
It's not always going to be easy. And sometimes we have to say, like, we're doing this not because of you. So smoking, we're not taking your right to smoke away. We never have. We've never said you can't smoke. We're saying you can't smoke here. Because when you smoke here, you are infringing on other people's rights. We have the data that show that people who never smoked still had cotinine levels in their blood. So you can smoke, you just can't smoke here. And I think that's a fair compromise, right? I mean, that's something that we have to be able to do together and say, look, here's times. So even when we think about, why did we, when we talked about COVID vaccination, we led with, if you don't get a COVID vaccination, you're stupid, or you're going to kill your grandmother. We needed more nuanced messages. What's important to you? If this is important to you, this vaccine will help you get back to that. So there's no, let me be like super clear. There's no easy fix to any of this stuff. We've taken a long time digging ourselves a hole. It's going to take a long time to get out of that hole. But these are ideas that we can just start to talk about. What you think about the WIFM, when you're sitting across the table from a superintendent of schools, and you want to talk about teen pregnancy, you start with teen pregnancy is one of the leading reasons that kids drop out of school. You want to get that you want to get graduation rates up, let's work together on preventing teen pregnancy. Okay, so if I work with you, I get higher graduation rates. Yes, you do. Okay, let's talk about teen pregnancy. You feel me on that? Like, this is when I like an audience, and you can go, yes, I'm
Yeah,
with you, Brian.
it's kind of, kind of getting to yes, right? It's
It
getting
is
to
getting to
yes.
yes. With
Yeah,
them getting to yes, it's all the same thing. And
yeah, yeah.
we in public health think of our stuff as religion, or math, right? 2 + 2 is 4. It's always 4. And if you say it's 7, you're wrong. The number of conversations I've been in the last week, about the last week, about Trump's win. Oh, they're racist, they're sexist, they're awful, they're stupid, they're uneducated. Really? What they did wasn't wrong. They chose a candidate with whom you disagree. That's not wrong. Now let's figure out why our agenda, why, if you are a Dem voter, why people picked a sex abusing felon over a woman who dedicated her life to public service. I'm just asking. It's a question, but they weren't wrong. And to write everyone off, to write off the 71 million some odd, or how many ever million, voted for Trump as just sexist and racist and bro culture, that's we're not going to win that way, right? I gotta make people healthy, whether it's bro culture or some other culture, right? That's our job. So it's not religion, it's not math. There are shades of gray. And listen, I'll give you another phenomenally great example that we don't talk about. Remember when we told everybody the lab leak theory was a conspiracy theory? Remember that? And we threw people off Twitter because of it. And if you said it in a party, you were thrown out of the party. Remember that? And then a couple weeks later, folks were like, well, I mean, it's plausible. I was like, no, wait. You said it was a conspiracy theory. But now you're like, maybe they're right, but I was chastised. I will never trust you again. See, we wrote that, we went with that as a conspiracy theory, and we spoke with certainty when there was none. We still don't really know where COVID came from. It's all theory. So everyone gets a theory, right? Now, some are going to be more plausible than others. Now, this is today. I'm 50. I look hella good for 50, I know. But I am 50, and that meant I was 8 years old when the HIV pandemic began. And I don't know how that pandemic would have played out today, because the HIV doesn't cause AIDS crew is still around. They go to every World AIDS conference and they're like, yeah, it's not right. But today they would have found a whole world on social media. And that's part of the challenge. We now live in this, social media world. So I don't know. I don't know how AIDS would have played out in this world. I could see whole tweets about AIDS was just created by the condom companies to increase sales. But we would have to be much stronger, better, faster with our messaging and our response.
Yeah, and as a follow-up to that, one of the attendees asked, we lost the battle of real science versus fake science during COVID. So how do we regain that trust? And I think that follows on what you were just getting at. So the next question we have, policy level intervention for youth mental health, statewide, later school times for high schools. Okay, that was just a statement. So yeah, looking
Trust
at,
me, getting
yeah,
my high schooler up, my son has to get out of here at 6:50 every morning. So I am down with that. But now we have to advocate, right? Now you have to get the evidence together, but evidence doesn't carry a day. Remember, the word number, the first 4 letters of number is num. So good data aren't enough. We need good data paired with good stories. That gives us power. Power leads to change. That's the change formula. But I need good stories from folks.
thanks. Going back to the drawing of the web of public health at the center, if public health is not the hub, but rather a spoke, who would the hub be?
I actually think it's many hubs, right? I think there's a government hub. I think there's a business hub. I think there's a religious hub. I think there's a hub of PTA moms. I think there's a hub of fantasy football playing dudes. I think it's all of it, right? I think there are many hubs. I don't think there's one. And we need We need to be like Mystique in the X-Men. And if you don't know the X-Men or get the reference, dude, what are you doing? Read some X-Men. But, you know, someone who changes, who's always flexible. Now, of course, Mystique is a villain, but fair. The idea of how do we change? How do we get our message right? How does my message to a group of business people change from a group of community leaders? But ultimately, this is the cool thing, guys. Okay. Everybody on the webinar, coolest thing. We all agree at the outcome. We all agree in the outcome. We all want healthy people. Okay. We look at like children's health. I don't know that there's an elected who says, oh, children, those needy bastards, let them die. I don't think that's an electable stance in America yet. So let's keep it that way. We can work together on child health. We can work together on life expectancy, but we agree on the outcome. We disagree on the paths to that outcome. Okay, that's the issue. How do we find more commonality in the paths and the funding to get to that outcome? But we agree on the outcome. That's huge. Pro-life, pro-choice folk, they don't agree on the outcome. They're further back than we are. But live with that when you go home for Thanksgiving, everybody in that room wants to live the longest and happiest life they can.
Thanks. So we want you to look into your crystal ball here. So how do you predict the next administration will respond to the H5N1 outbreak or whatever the next outbreak is after that? Should we be preparing in the same way as we did for COVID?
Public health is at the discretion of the states. It is not a strong federal issue. RFK Jr. can use money. He could defund states and schools that require vaccination. He could do that. He can't outlaw vaccines. It's not within the federal government's purview. You may not like the outcome post-Roe, but it is indicative of the fact that it is an issue of the states now. And so some states have allowed it. Super red states have said we're going to have abortion. So we have to be ready at a state level to have the strongest public health possible. But also everybody on the call, I want you to not get upset about rhetoric. Okay? The first bill, I believe this is still true. The first bill often, I think always, introduced in the Texas legislative session is a bill to secede from the union. Do you know that? It's true. And so no one really gets bent out of shape about it because it's just like a thing, right? Texas, I think constitutionally, is the only state that is allowed to secede from the union. I was a Texan for several years. It's wild. There's a lot of wild, interesting historical and policy things in Texas. But no one gets upset because it's not real. So defunding schools that require a vaccine, that's a great rhetorical talking point. It whoops up the base. Show me the bill. Show me the support for the bill. You know what? I want everybody on the call to know no one's touching Obamacare. No one's touching it. And they're not touching it because if you take away an entitlement from the American public, the retribution will be amazing. If you take the fact that I hate Obamacare. Obamacare is the worst thing. Where are you going? My doctor. Oh, well, that's good because you can go to the doctor because of okay, you can hate Obamacare. That's cool. If I now can't go to my doctor, I'm going to know who took that away from me. So politics and rhetoric. Call me back when RFK Jr. is CDC director, when RFK Jr. is HHS secretary, or maybe he's just going to fade into the background, right? I'm much more concerned about Musk and Ramaswamy, people who have had no experience working in government, overseeing a government efficiency department, which didn't exist but for a couple of days ago. That worries me because that could be real. But now what I want to see is how many employees that department's going to have. What's its budget going to be? Right? There's going to be changes. There are going to be changes we don't like. But we're going to have to really think about how we're reacting to it and preparing so that the people who live in our state, like you guys are in New Jersey, you're good. right? My daughter and I have had this fight 1,000 times. She's 13. Pray for me, guys, like all the time. She's like, Dad, this is horrible. Because of Roe, I won't be able to get an abortion. And I was like, well, no, that's not true. You live in Maryland. You will be able to get an abortion. More importantly, even if we outlawed it in Maryland, we have the resources to get you an abortion. So let's just be clear about our rhetoric and what we're saying. People who live in a state like Texas, where it's not easy to get to other states, who don't have the resources, they are denied abortion. Having an abortion law at 6 weeks or something crazy, that's hard because you often don't even know you're pregnant 6 weeks into a pregnancy. So we have to be tight and be thoughtful about what we're saying. So just because we don't like something, we can't just say, well, this means I can't this. No, that's not totally true. Let's be true about who it actually hits.
Great. I think we have one more question I'm going to ask you.
I just want to say the resource, it's the RWJ resource. You can do RWJ messaging, health equity to get to those resources at RWJ. They're really good. I will send, I don't know, Mitch, if you can do this, but I'll send the slides.
Yeah, we can get them out. We can post them. And
I'm going to send slides to Mitch.
Yeah. So what skills do you think are most important for undergrads wishing to get their MPH so they can be successful in the workforce, especially in areas like policy, data analysis, and community outreach? And we've got like a minute. So
okay, so policy analysis, knowing how to look at data, knowing how to use data, how to visualize data. Take a communications course. If the School of Public Health doesn't offer it, go over to the communications department, right? Have a good, you got to write, guys. Write well, write compelling. You live in a world of egalitarian journalism. So I want you to start writing. I want you to put a Medium blog up. Start being able to share your ideas in a way that everyone that you know will like and at least engage with you, right? This is the first thing everyone told me when we did Republican focus groups is don't call me stupid. Isn't that like kind of simple? Don't call them stupid. That makes sense. But we did that. So really looking at, I want you to take only courses that give you a skill. Don't take like 4 steps to health equity or the theory of health equity. Don't do any of that. Read about it. Don't take those courses. Take courses that give you skills. Mapping is a skill. Data analysis is a skill. Policy analysis is a skill. The 5 steps of Prochaska is not a skill. Sorry, health behavior people. That's something you can learn. Take classes that get how to do a community health assessment. Community organizing, that's a skill. Skills. When you're in an educational situation, get yourself skills. Read books about knowledge and perspective. So that when I open my School of Public Health, all my classes will be skill-based.
Thanks so much, Brian. We really appreciate your presentation today. One of the comments is that you have a vote as the next president. So maybe in your next career after dean of the new School of Public Health, you'll be president. So thank you so much. We really appreciate your time and all you do for public health.
Can I say one thing?
Yeah, go ahead.
This is not a one-night stand. This is a first date.
Yeah.
So if you wrote a question, you didn't get an answer to the question, follow me on LinkedIn, send it via LinkedIn, and my email address is easy to find. It's castrucci@beaumont.org. I'm a real person. I will not respond quickly, but I will respond. So don't think this just ends here. If you need help, you call and we'll help. Like we are real people. We are all colleagues. We are just on different places in the road. But let us help you, those of us who are further along the public health road, hopefully better than the witches road if you were a Agatha fan.
Yeah. Yeah. Thanks so much for that. And we'll get your email out to people. So thank you everybody for attending our session of the 21st Signature Series. Our next one is Tuesday, January 28th, 2025 with Dr. Shah Mohammed from the Bouvet College of Health Sciences. And if you're looking for CHES or New Jersey Public Health credits, there's a link that Nikesha is going to put in the chat box if she hasn't already, and fill that out and we'll get your credits to you. Everybody, wishing you well and be safe. And thanks again, Brian, for your incredible presentation and friendship.
Thanks, guys.
Bye, everybody.